Governor Cuomo is proposing eliminating crossover Medicaid payments and supplemental Medicaid out of the state budget.
News Channel 2's Kirk Tupai explains what that impact of the cuts could mean to the local ambulance companies.
Cuts in the proposed state budget could be the death of rural ambulance services across the state. In rural areas of Herkimer County, as much as 60% of the ambulance services are paid for by Medicaid or Medicare. MOVAC President Greg Eisenhut says most insurance companies pay roughly 36 to 40 cents back on the dollar, but payments from the state are even worse.
When we go to Medicare patients, the bulk of our patients, we're probably getting less than 30 cents on the dollar back. And if we're talking Medicaid patients, we're probably getting somewhere between 10 and 15 cents back on the dollar.
Eisenhut tells us rural departments are hit the hardest, mostly because there are less calls resulting in less money, but they also have to dedicate more resources because of location.
We're with that patient a lot longer than somebody, let's say in the city of Utica or the city of Rome, where you're right at Mohawk Valley Health Systems or you're right at Rome Memorial Hospital, and then you get right back in service again.
Rural departments are also faced with a higher percentage of low-income families that often refuse to pay for services. This stack of papers represents around $250,000 in unpaid bills for MOVAC. It's a problem that only gets compounded to smaller providers if the state makes cuts.
Most of them have no reserve funds left. We've all spent down our reserve funds, so we live hand to mouth. Whatever we get in from our bills goes to pay bills or payroll if we can even do it.
If these cuts to the state budget are approved, struggling ambulance services like MOVAC could be forced out of business, and that would mean longer wait times to get to a hospital. In Little Falls, I'm Kirk Tupai reporting for News Channel 2.